Well, I'll go ahead and start then with just the concerns about the access to the payroll protection funding. And as I think, and people spoke about this on the governor's call also, that the banks are just no longer accepting applications at this time, and the funds have been exhausted. So, our fault for maybe being a little bit late to the party, but it's a big pressing need, and I think you'll hear that from everybody who has not already gotten applications in.
Right.
Did you apply, and we're waiting, or you didn't apply yet?
No, we were actually just getting ready to apply the first of this week.
I'm in the same boat. I was apprehensive about applying for that money because I felt like I needed to understand in detail, and that's just my personality. I don't like going for things unless I, am very comfortable with it. So I, took some time to learn more, and it's feeling pretty scary now, like we've missed that opportunity.
Yeah.
Well, hopefully Congress will, as soon as the bill came out, both sides of the aisle were saying that they were going to increase funding should it come to that. But as of now, they are not accepting. The government is no longer accepting new applications. I think it's just a wait and see for who applied at what date and stage and where they are in the queue, right? So we know they publicly announced no more applications, but who knows how far back they'll go.
Yeah, but I would almost suggest that if you don't let that hold you up. Maybe if you're already working with your lender, contact your bank to see what materials you would need, even if they won't accept it. I mean, because for some, it's going to be a process. Collecting all of that data is not, won't happen. For some people, it took a lot longer than they expected. So if you haven't already, and there's applications out there, and then there's like a certain list of things that they would need. So you can at least have it ready in the event that they did open funding back up, you would be like ready to go, and you're not, waiting a couple more days to collect it all.
And that's kind of where we're sitting right now is if somebody would say we can submit, we're ready.
You got it all. Okay, good. Yeah, as long as if you have it all, then that's probably the best position to be in. Because listen, like you put your application in and you get approved and you don't need it, you don't have to take it. So you could go through that process if it opened back up.
And then I guess the question is, if you don't, have you done the planning or thinking on if you don't get it, what actions you're going to need to take regarding your staff or other costs?
We have done a lot of that. That's not a pleasant thing, but yes, because we've taken a look at, we've been lucky and we've gotten some small grants, local grants here to help support and sustain some new services and programs that we're putting out there. We're a large senior citizen nutrition program. And we have put out a lot of emergency meals and shelf stable and frozen, some of those other kind of things, and done grocery shopping programs. So there's other revenue sources coming in to help supplement that lost income, but it's not of the magnitude that's going to replace all that lost income.
So Melissa, how do you want to proceed, right? I mean, we only have a few people here. I mean, we don't literally have to go through every single slide by slide, but maybe we just touch on a couple of points here and there. And then as we're on a particular slide, let's have those who are on the call ask questions. And how do you want to move this forward? Melissa, you're on mute.
Yeah, sorry. I was like, I can't find it. Too many windows going. No, I think that we can definitely do that because we want to maximize, usage of your time and not spend time where it may not be super helpful. So one of the things, obviously, as we were already talking about, was just, you all are looking at your funding levels and on a constant basis of what's coming in, as you just said, and what's going out. And so obviously the questions that you have now, especially if you're not getting money, is do I need to do additional furloughs? Do I need to do pay cuts? Do I need to do layoffs of your staff? And we can definitely help consult with you if those are things you haven't already contemplated but need to start thinking about. But just any, as we go through this, one of the things we want to just caution is that we are not employment attorneys or tax advisors, et cetera. So we're going to give you the best information that we have right now and best advice, but obviously.
In my webinar workstation is a list of the participants in my class. Let me blow that up for you. So in this
Hi.
class, you can see that Carol Abrams is on slide 22. So
Uh,
if I'm in
Hey,
presentation
Liza, how are you?
I just muted her.
mode, I'll ask a question.
Okay.
I can go to my keyboard.
well, that's not her then.
Yeah, I just muted her.
Okay.
Were we expecting Eliza?
Hey, Eliza, which organization are you with?
Hi, I'm sorry. I was trying to get off another call. This is Eliza. I'm here.
Okay.
Hi, how are you?
I just don't have my video on. I don't know if you need it on.
No, it's okay.
We love it, but it's not required.
Okay.
And so, Eliza, we just really kind of started, and we're going to jump around a little bit based on what everybody's needs are. And so we're just talking a little bit around just grounding as far as Michelle and Susan and I, lots of HR experience between the three of us focusing in this space, but, are becoming experts at this, but, clearly not attorneys or advisors. So make sure you get that validation from your brokers or your advisors on the actions that you're taking, which we're a couple weeks in now. So you probably spent more time talking to them than you probably wanted or hoped to for the month of April, but do strongly encourage that. Originally, we were going to talk a lot about the CARES Act, but as we just talked about, the funding isn't necessarily there. So Susan, you want to guide me on what you want to focus on of just highlighting?
Yeah, so I think, everybody's in a very tough position right now, but I do think that every organization needs to focus on, what are their biggest needs and how best to sort of manage their cash flow over the 30, 60, 90-day period. And since, many of you are obviously in a very mission-oriented role, how is this going to impact your community, your donors, and those who you serve, right, based on what you have. So I don't think that's new news to anyone. I'm sure all of you are having those same conversations as you're thinking about your budgets. We just flipped to slide 6. As we just talked about this morning, literally we updated this slide yesterday afternoon because we were hearing that the idle advances have now been reduced and people are, the 3-day waiting period that the government said that they're going to be able to issue money turned into 2 weeks. And now as of late yesterday, this morning, no longer is the idle grants available, as well as the idle loan, right? And now we're also hearing that the PPP loan has also paused. And I'll just use the word pause, meaning they're not accepting any more applications, which several of you have already experienced firsthand. I think the question is, does that queue stop? Because obviously there were hundreds of thousands of applications already in progress. So I guess we'll have to wait and see. And like Michelle said earlier on the call today, you know what, let's for now hope and cross our fingers and assume that more money will open up. So continue the process in terms of getting all of your documentation, supporting material, as well as completing the application. And let's see what happens in terms of Congress adding more money and the opportunity to apply for one or both of those programs. The terms still haven't changed. I mean, they haven't talked about that. So, you know, we have these slides on the Dana website, so you can always refer back to them. So I won't go into the details about eligibility, which all of you on the call are, and how do you calculate. And I think right now, you know, again, they said the maximum for the idle loan was about $2 million. Well, then it just bumped, they just moved it down to 15,000 max per company. Who knows what that's going to look like once I'm assuming, I'm hoping that they'll open up those funding options again. But we're just going to have to wait and see, right? It seems like every day there's something new that comes out. And then the other thing is, I think, you know, with this massive flood of applications coming through, where the language across all of the guidance coming out from the government says that it's incumbent upon the borrower to demonstrate and prove that they need the money, they're going to use it for those certain purposes. I think there's a lot of concern from banks, and they're reaching out to the White House and to the government saying they want some sort of safe harbor for potential liability that'll sit on their books. So let's just go to the next slide, which I think is pretty much the same. And then if we just go to so there still is available, and I don't know if on the governor's call earlier today, if someone has an update beyond this, because that Delaware Hospitality or Help program is available, and it's being administered to the small business program. It is primarily for the hospitality industry, but there are several, and I listed which I thought were nonprofit related industries, such as museums and historical sites, those who promote performing arts. I think the New Candlelight Inn is part of that category, scenic and sightseeing. So if you're in these sort of buckets, you're also eligible to apply for this help loan. Listed the requirement in terms of being in operation and open for at least a year, and your annual revenue is less than $2.5 million. So this 10,000 max per month. So the way that the application works is you apply for a maximum of $10,000 per month. If you need more than that, and I actually was communicating back with the Delaware division because it was unclear as far as if it meant 10,000 cap forever. And what I was told directly from the Delaware Small Business Program is that for every month you need 10,000 or more, you have to reapply. Not very streamlined, not very efficient, but that's their process as of now. It's a zero interest loan, which is a good thing, with a 10-year repayment period and deferring up to 9 months. But even though there's zero interest, you still have to pay back whatever you're asking to borrow. And the application is there. I have a link to it if anyone's interested. And then certainly there's more information on the actual site itself in terms of how to determine the cost. Now, one of the things right here is it doesn't include personnel costs, where the PPP does include that. And I think this is sort of a complement to the PPP, because that loan, if you are going to get it, did, majority 75% tie back to payroll costs, whereas this one, it's for other business and operating expenses. So I guess we just go to the next slide. Regardless of any loans that you do get from whether the state of government or the state of Delaware or the federal government, tracking your expenses, whether it's an Excel sheet or if you have QuickBooks and creating some sub accounts. And then I think when we started the call earlier today, I think, Charmaine, maybe I've got your name wrong, sorry. I know you had said this year will be fine, but next year is going to be a problem. And so I know many of us are already thinking about how do we get through this period, but post COVID-19, what is our world going to look like, and how do we need to think differently? So that's it for this section. And there's some resources. And I think if you go to those websites, you can get the most updated information. So thank you.
So I'll turn it to Michelle, and she's going to talk a little bit about Families First Coronavirus Response Act. But just out of curiosity, have any of you had employees who have needed to take or started requesting leave since April 1st? Yeah. Okay, so this is real for you.
Okay,
Yes,
and have you guys already have you already responded to Families First, or is this going to be new material for you?
no, I'm pretty familiar with it, and we do have a couple of employees that are out with it.
Okay,
Well,
and if you don't mind me asking, how many employees do you have?
between 155 to 160, depending on where we are with hiring and things.
Okay, so you're definitely in that over 50.
Yeah.
Okay. All right, good. All right, so I will probably go through this a little quicker than we have in the past, only because it's been out now for about 2 weeks, and there was a lot of conversations about it prior to it even coming out. So everyone knows that this was signed into law about mid-March. It went into effect last 2 weeks ago, I guess, on April 1st. If you haven't already, if you're on the call and you haven't already shared this information, there's a Department of Labor poster which will we have connected a link to. If you have not shared the notice with your employees, you must do so, even if they're teleworking or if your office is open. However means your employees are currently working, you do need to get the information to them. And even if you're going to take the exemption, which we'll talk about, you still are required to get the notification to them. So this does, and the reason I asked about the number of employees, as you know, is that this is for employers that have less than 500 employees. If you are less than 50 employees, depending on when someone may need this, because we know our numbers are kind of up and down, you can seek an exemption. As of this morning, there's still no language or process in terms of how you seek that exemption by the Department of Labor. But the Department of Labor website still has that it's coming. It's coming in April. So although we're April 16th, that language is still coming. So there's two pieces of the legislation. One is paid sick leave. The other is expanded leave related to other things, which we'll go into. Okay, great. So the paid sick leave, there's two components of it. Again, the paid sick leave part, your employees could be with you day one and they could qualify. So there's no eligibility period. So unlike the medical leave, which we'll talk about, the expanded leave, they have to be employed for 30 days. The sick leave, they automatically are eligible. And your full-time employees will get 80 hours of paid sick leave related to COVID-19. If they're part-time, then that would be prorated based on over a 2-week period, the average of a 2-week period. Okay. So how do they qualify for this paid sick leave? And I know in the beginning there was there was some gray areas about what qualifies you and what doesn't, especially as we were all moving to a stay-at-home work or stay-at-home state, and people being quarantined, either self-quarantine or otherwise. But in order to qualify this, you need to be exposed, diagnosed, being treated, tested for COVID-19. So if they're if they received a test and they've been told to quarantine or isolate by a doctor, or they've actually tested positive, or they're being treated, then they would qualify for this paid sick leave. We're just gonna keep on going kind of through it a little quickly. Yep. All right, you do have to pay the employees their regular rate of pay or minimum wage. Hopefully you're all paying minimum wage. We're making that assumption. You do, this is leave, well, be above and beyond any leave that you're currently offering. So if you have a sick or vacation or PTO policy, this is in addition to that. So you should not, if you have employees that are out, you should not be docking them their sick, vacation, or PTO banks. This is a separate benefit. And as we know today, this law stays into effect until December 31st, or if it's stopped early or extended by HHS. Okay. Any questions on the sick leave before I move to the expanded leave? Okay, because I think the sick leave is really self-explanatory. You have someone that needs the benefit, you're going to give them sick time. We're going to talk about in a few minutes. The important part is that you're going to take that payroll tax credit, because I mean, as an HR professional, I feel like this benefit is not only to the benefit of the employee, but there's certainly an employer benefit to it as well. So make sure you're documenting everything. So if they requested the leave, and we'll go through this, that you're getting the documentation and that you're working with your payroll company to make sure you get the payroll tax credit. My opinion is the expanded leave is a little bit more like gray, and I think we'll be a little bit more on the employer rather than employee in terms of how you're administrating the leave. So this leave is to, you can take time off to care for children whose either school or daycare center is closed due to COVID-19. Right now we're in the school year. We do look for this to expand, and what will be eligible is the summer, although kids aren't in school generally in the summer, but there's camps and there's daycare facilities and so forth. So as it looks now, we do look that will still qualify come summertime. This is an amendment to FMLA. So if you're currently over 50, hopefully you're administering FMLA. And so the time that is used for expanded leave will be time count towards typical FMLA. The expanded leave is a little different from the sick leave, is that you have to be employed for 30 days. So if you had someone who just started last week and they need to take time off, they're going to have to wait 30 days before they're eligible. All right, in terms of how it's paid and how it's administered, the first 10 days is going to be unpaid. It doesn't mean that they're not going to be paid. It just means that as an employer, you're not required to pay them. If they have any accrued PTO, vacation, or sick time that they're able to use, then they can use that to still get a paycheck. But you don't have to, as an employer, put out any additional money beyond any accrued benefits that they may have. After that 10 days, and the 10 days is 10 business days. So after that 10 days, the employer will need to pay the employee 2/3 of the regular rate of pay. And it's up, there is a cap, a daily cap that each employee would receive. And this has the same effective date, April 1st to December 31st. We did include for you kind of a leave summary. So if you do find yourself where you've got people who are out, it's a quick checklist to see, or cheat sheet to see where, you know, how much leave they could get, what they're eligible for. And you may have employees who use both, and they may use it not only for themselves, but then they could turn around and use it for a family member. So if they need the paid sick leave, and then they need to later take the sick leave for their family, so maybe they're exposed and they're quarantined, and then their family member gets it and they need to care for it. So there's multiple ways that people could be eligible for the leave. If you are under, this has come up in previous conversations, but if you are under 50 employees and you're going to look to take the exemption, you can actually break these, from what we understand, you can break these apart. So perhaps you're going to allow your employees to use the paid sick leave portion and not the expanded leave. You can do that. So it's not if you participate, you have to participate in both of them. Because for some employers, they can, if they're under 50, they can demonstrate that offering this expanded leave would create a hardship for the organization. So that could be an option for you. Only if you're under 50. If you're between 51 and 500, then you would need to, these would apply to your organization. Okay, so the exceptions, we have a lot, I think in the next 3 slides. It's kind of wordy, but we wanted to at least get you all the information, and just knowing that the information that we have provided does update regularly. That's why this morning I went and double checked the Department of Labor website to see if they've put any updates out. But again, as of this morning, there is no updates in terms of how do you get that exemption, because we do know many nonprofits have below 50 employees. And so if you can demonstrate that by offering this is creating a hardship and that you don't want to offer it, then how you're going to get that exemption, we're just going to have to wait and see. We could probably go through these most a little quickly. Yep, I think we'll keep going through that. Yeah, these are kind of basically all say the same thing, but it's just, you know, some good information for you to have. But we're going to link to the Department of Labor. I would recommend that if you do find yourself in this situation, that you're going back and reading all of the updates. Okay. The one thing, I don't know if we have the next slide, we didn't talk, I'll talk briefly about, as an employer, your obligation is that you must document. So if you have an employee that is requesting the leave, make sure that you have a leave request. We can certainly, I know the last week we offered to give a sample of it. There are so many samples that are out there right now, but the Department of Labor hasn't come out with a standard form. You know, the FMLA forms are pretty standard. You can download them from the Department of Labor website, whereas they haven't come out with a standard form for this. My opinion is, as long as you have something documented where the employee has requested either the sick time or has requested the leave, they've signed the document. As an employer, you have countersigned that document, demonstrating that you are going to give them the leave. And then the second step, or the sick time or the leave, the second step would be that you're working with your payroll vendor, or if you have to do it manually in an Excel spreadsheet, you're somehow tracking that time off. Almost every payroll company that I work with, about 6 or 7 of them and various clients, almost every one of them have come out with some type of tracking mechanism, whether that be a code that you're using for the pay, or even some of the more sophisticated ones are actually coming out with, you know, calendars, like timesheet calendars, in which you can kind of document how long somebody has been out or what leave they have used. Okay. Any questions? We have a kind of a breaking point of some of the stuff. Any questions about the Family First? No? Okay. You guys probably all know this as well. Some of the stuff is getting a little, I wouldn't say outdated, but you know, it's been out for about a month or so. But under Family First, there is a health insurance piece of it where, and hopefully you've all received an update or notice from either your broker or your health insurance carrier that health insurance companies are waiving copays, deductibles, out-of-pocket expenses related to COVID-19. So if you do have employees that are being tested, if they're being treated, and they are receiving invoices for this, you need to make sure to work with your broker and your insurance company, because it was likely either coded wrong or you know, in error. And I did see, if you have, you know, good connections with your broker and are constantly getting updates from them, I know I get updates every day. I did see that brokers are already starting to talk about what COVID-19, the costs that these insurance companies are absorbing, what that's going to unfortunately do to renewals coming up. So I'm joining a call next Monday with a pretty large broker that'll start having those projections of what insurance costs unfortunately may look like as a result of that. All right, and I think we touched a little bit on this as well. Just make sure, it sounds like at least 2 on the call do have employees who are falling under the Family First. So you know, make sure you're getting your payroll tax credit, because again, as an employer, this is of benefit to you as well. Okay. All right, and if you haven't already, please share the poster. Okay, even if you're exempt, make sure you get it out. That people have access to it. You can email it, you can put it on your internal directory or website or whatever you may have for your employees to kind of see things internally, not externally. Or if you have employees that are still going to the workplace, you can post it also with your other Department of Labor posters. And then if anyone needs any assistance in terms of a tracker or a response template, we'd be happy to provide that information. Or if I know last week for some employers who are under 50, we help provide language if you haven't already notified your employees, and it's not too late. I mean, we're only 2 weeks in, so you certainly should do that if you want to include something in the notice that goes out that you will be taking an exemption as an employer under 50. Okay. All right, any questions at all on Family First? Sounds like at least Mamie, you and Ken have experience with this already.
I lost my mouse moving between 2 screens here. I'm sorry. We do have some limited experience with this, and hopefully it continues to be limited experience.
Yes.
All I know is that we have had 1 employee who has tested positive and is on leave right now for this, in recovery, hopefully in recovery.
Good, good. Hopefully in recovery. That's right. That's the key word, right?
Right.
True enough.
Yeah. The one thing I didn't mention, I don't think I did, I'm like losing track of everything I say day to day, is that, because I feel like I listen to this stuff in my sleep now, is that if you have employees who have been on FMLA this year, this either this calendar year or a rollback year, however, depending on how you track your FMLA, you know, this isn't on top of the 12 weeks they already receive, or I have some clients that are in DC, so they get 16 weeks. It's not in addition to, right? So it's part of. So if they took 6 weeks, you know, back in January for medical leave or maternity leave, then they have 6 weeks kind of left in that combined state.
So for your 3 organizations that you are all a part of, what are some of the things that you're grappling with now? I mean, obviously the PPP, because you're on this call, but beyond just the CARES Act, what's top of mind for your not-for-profits right now?
Well, we have a lot of part-time employees, a lot of direct care workers, hands-on, and those services are no longer being rendered. So it's a matter of how do we keep these part-time employees still productively employed. And we've a lot of our, the example, bus drivers, a lot of our bus drivers are older people, retired people, and we've changed some of our positions now that they have a physical component in the institutional food production, and they physically are just not able to do that for extended periods of time. So trying to find alternate job duties to keep these people productively employed, the large numbers of them, during this period is a problem.
Okay. Okay. Go ahead, Mamie. I was just reading a response. Go ahead.
Oh, okay. I was just going to say, for People's Place, we do all kind of things. We have 3 domestic violence shelter and a large homeless shelter. And I think that I am extremely grateful that I have the employees that work for us for the right reason. They've continued to come to work and do their jobs really without too much complaining. They're scared, they're worried like everybody else is, but they, have been doing a great job. I would really like to pay some sort of differential pay for these people. They have more exposure. We're doing everything that we can for them as far as, getting masks and gloves, and we clean multiple times a day. So we've really stepped all that up. But, I do think that I would love to be able to pay them some hazard pay of some sort. It wouldn't have to be a lot. I think it would go a long way. But without, being able to get any financial support for that, it's just going to be really tough. So anyway, that's, something that I've been thinking a lot about. How can I do this? What's the incentive for the people that are out there all the time, truly putting it on the line to help other people. I don't know. I think they should get something for that. And I'm still working on a way to do that.
I think that's a great idea. Especially, those who are out there, like you said, on the front line, they're in a higher risk category, and to say thank you, is, go a long way.
And I think you have 2 options. Obviously, one is that hazard pay during it, but you may, if your funding part doesn't come through until a little bit later, also offering really a bonus to say thank you after the fact. Though you want to be able to do it during, but if your funding part doesn't work out for a little while, I think people will still appreciate a bonus recognition to say thank you. We know you did extra.
Yeah. Thank you.
And Karen, I know you don't have audio, but anything you want to share either in the chat box?
She did. So I'll read you her question. She said that she had an employee request the leave due to homeschooling. However, her son is over 14, so she did not qualify. And so her question is, and maybe Michelle, if you want to take this first, should I give her something in writing saying why it was not granted? And then separately, just as a comment, she wrote funding, trying to come up with new ways to be engaged with their members since they aren't in the building. Yeah.
Mm-hmm. Yeah, all great questions. So yes, I do believe that you should respond in writing, and that would be a simple some of the forms that at least the template we have and the ones that we've seen out there, they do have that approved or not approved. So I would get back to them. You maybe as a best practice to call them or email them to let them know that it's coming, that you have not approved it. One thing I would be prepared for, check in on that it is 14. However, if they do have a disability, then over the age of 14, there is an exception. So if you have someone who is 15 plus and they have a disability, then that you can qualify for the leave. So that you'd be prepared for that to possibly come up.
But they would need to provide the medical documentation.
Yeah, you could. And there's different ways that you, there's different ways you could do that. Maybe that's through an IEP, or through something from a doctor's note from a physician or whatever it may be. And the other thing, depending on the situation, whether or not the employee is coming to work and it's just physically not able to, come to work and work, or if they're teleworking, there is, really, your organization best. But is this person working a standard 8 to 4, 9 to 5 job, or is there an opportunity for them to kind of work around the school schedule? right? And maybe it's not school, maybe, well, it sounds like it's the person is older, so I'm assuming they're in school. But maybe it's to work around it. I mean, I know I have 4 children between the ages of 8 and 16, and they're not in school 8 hours, right? You know, they're getting 3-4 hours of work. I mean, certainly you got to keep them occupied in other ways, but perhaps there's that flexibility, and that's working with the employee to offer flexibility of how they can still get their job done, maybe just not in their standard hours. Unless there's a business need. If there's a business need for them to be available core hours, then that's a different conversation.
In
Great
terms of
questions.
Yeah, funding. So there's a lot of organizations out there now that are offering grants to not-for-profits outside of the quote traditional. I know Google has something going on. Microsoft has started something, and in fact, there's a way for donors to provide donations to over 1 million not-for-profits around the world. So I would be more than happy to share a few with Paul, and then maybe he can share it with a broader organization, because I think that I've seen some funding opportunities out there for specifically just for not-for-profits, not for small businesses. So I'll share what I have, and maybe you guys can take advantage of some of these other grant opportunities that are out there beyond some of the traditional programs that we're seeing right now.
I think the other thing, to Karen's point of not seeing, people directly of the donors or the people you support, if you are not already a social media savvy organization, this may be the time to figure it out. Whether you find a smart teenager who has time on their hands, a college student who's savvy, or you go learn it on, some websites and stuff, like this is the time to figure it out, because there are people out there that want to do something. So if you haven't tapped into that, it's probably a good time to figure it out. If you have a little bit of capacity, or you know somebody who's smart on how to take advantage of social media.
Kim, maybe you could redirect some of your part-time employees to take some online classes and come up with some things.
Well, you understand that the part-time employees I'm talking about are all plus 65, and these are retirees that drive buses for us part-time to transport seniors, and now they're delivering meals and things like that. They're not particularly tech savvy, and it is not likely that's going to change dramatically.
I'm just going to do a little plug for Goodwill of Delaware Counties. I know that some of you are thinking about potentially moving people around, may not have roles, etc. So I know the Goodwill of Delaware County, which I sit on the board, they've been working actively to do work on job placement, particularly with the Department of Labor, as well as several other organizations. So if there are needs to kind of shift people potentially out, Goodwill is offering some really great programs.
Any other questions that we can try and help answer? A lot of still unknowns, some things very known, some things not so much.
No, I don't think I have any questions at this point. Thank you though.
Okay. Well, we're glad that you're all able to join, and obviously wishing you the best in your funding challenges. And we'll continue to stay in touch with Paul to help support where we can, but wish you all a healthy, safe week ahead.
Thank you very much.
Thank you.
Thanks, everyone.
Everybody
Bye.
stay healthy.
You too.
You too.
Bye-bye.
Bye-bye.
Bye.